Hello viewers, welcome to our FP Live session. Today we have with us Senior Clinical Dietitian Varsha Gorey at Apollo Hospitals, Navi, Mumbai. Today we will discuss about importance of nutrition in cancer care.
So nutrition in cancer is a very vast topic. There is a preventive aspect as well as treatment. And we would like to focus on the treatment aspect. The reason being is when patients are undergoing treatment, there are wide multimodal therapies, radiation, chemotherapy, surgery, injections, maintenance therapies, and one of the commonest thing what we observe with our patient is weight loss. So how can we really maintain the patient's weight is important. Losing weight causes a lot of deleterious effects. For example, there's low energy levels, the quality of life get affected, there's a compromised immunity, and to combat that, maintenance of weight, healthy weight is important. Why do patients lose weight during these therapies is that there is a compromise in intake attributed to various side effects. For example, there is nausea or vomiting, there could be diarrhea, there could be mucositis, ulcerations, just feeling low, depressed, and taste changes, and so on. So we will look at one by one. At the starting, let's take nausea and vomiting. The sensation of nausea can be really bad for the patient because the thought of food will make him not eat food. Though he's hungry, but he's not able to eat it. So some few suggestions are that never force patient, but let the food be at the side of the patient whenever he feels like eating. Small meals. We cannot have patients who have nausea to have big, large portions like what we will eat as 3 or 4 meals as breakfast, lunch, dinner, but have small meals which can be just a soup bowl or it can be a glass of liquid. Let them be sipping it rather than having or gulping it in the larger volume, because if they gulp in a larger volume, they are going to have vomiting sensation. The temperature of the food is very important. It has to be appealing. And one more advice what I would like to give is that rinsing mouth with soda, baking soda or soda bicarb can be helpful because it decreases the mouth pH. The acidic feeling is decreased, the inflammatory response is decreased, and then urge to eat is better. The next complaint is like taste change. Taste alterations is generally like they often feel a metallic taste in mouth, and most of the cutlery, crockery what we use is steel. So if we opt for other kind of crockeries like glass, ceramic, sometimes plastic bowls which have a right appropriate temperature, they are safe to eat and they do not get the taste in the mouth while they are eating food. Again, rinsing mouth is helpful. Temperature of the food. Often it's always a good gesture to offer good warm hot food, but whenever there are taste changes, they are not able to adapt to the hot food, and room temperature food is better tolerated. Cold foods are better tolerated. Now when we say cold, there are a lot of options. It can be your plain dahi or curd, yogurt which is fruit flavored. It can be shrikhand, lassi, mishti dahi. So even if taking spoon by spoon in between the gaps, whenever they are traveling, whenever they are in hospital, when they have nothing to do, or just reading, or this can help. So while they are talking about taste changes, encourage our patients to have small frequent meals so that they are nourishing themselves. Milk cannot be tolerated often because they complain of mucus. There are alternate milk sources which can be protein-based beverages. In cancer management, we not only talk about good calories through carbohydrates or proteins, but fats is also important. So nut-based milks, soya milk, peanut used milks, coconut milk can be nourished with the food what they eat. Again, we find mucositis is a major problem in patients who may be undergoing radiation therapy, where they feel hungry, but the thought of food getting into mouth is very painful, discomfort due to the inflammation what happens in the mouth. Here again, rinsing mouth by soda is very helpful. Simple thing like, coating the mouth internally. There are medications, but apart from that, simple household remedies like having a cold kind of malai cream or white butter can be soothing and relieving. Followed by this, then they can have meal, they are able to tolerate it much better. Sucking ice cubes, frozen ice cubes, or it can be a fruit juices as pieces or chips, and holding in the mouth can give lot of relief, and then they can adapt to the meal following that. This will be soothing, this can be nourishing. Avoid acidic foods, because acidic food itself or citrus fruit itself can cause little irritation to the oral cavity. In such patients who have a higher degree of mucositis, they would require supplementation, special supplementation, which can be antioxidant enriched, glutamine based enriched supplements. That itself has proven a lot of benefits in mucositis. Now we've talked about nausea, vomiting, mucositis. When we talk about other type of cancers, there are digestive issues, such as there could be before digestion there could be swallowing issues, and to deal with swallowing or to deal with dysphagia, we need to have a soft consistency diet. Now dysphagia diets are of many types. You can have liquid diet, you can have puree, paste, or a bland diet, which can be even a thick consistency like a soft solid diet. What patient will really suit, we have to really identify sitting with the patient and then plan accordingly. But the puree diet will be changing into 4 to 6 types of consistency, and we have to help the patient adapt different consistency. In nutrition, food groups will not change. We will include all the food groups. If they are not able to have chapatis and rice, we can go for certain starchy vegetables like potato, sweet potato, mashed pommes. We can have eggs like boiled or scrambled. It can be even made into a smoothie kind, so they will be nourishing drinks. Now talking about other gastric issues like constipation or diarrhea. Diarrhea patients suffer for a longer time because they lose the important elements, they lose a lot of fluids, electrolytes, and they are not able to tolerate food for a longer time. They just sustain on juices, coconut water, which is not at all going to be healthy in long run. For a day or two it is fine, but when you are talking on long-term management, for diarrhea patient, opt for rice-based foods, soft cooked mashed foods, avoid raw juices and raw foods. If you are going for raw foods, it can in fact aggravate the diarrhea. Taking cooked foods or pureed foods would be or stewed foods would be a better option. So whenever we are talking about diarrhea, it's not only diarrhea, it could be followed by vomiting also. So when we talk about patients, there would be a combination of treatments, and one kind of a therapy is not going to suit the patient. So if you really want to consider a better advice, then reach out to us, write to us, speak to us the way you would like. Thank you very much.